Sleep apnea. It is one of the most common killers that happens while people are completely unaware. During sleep, the muscles in the throat relax so much that they partially or fully block the airway, causing breathing to stop repeatedly throughout the night. Each time this happens, the brain jolts the body awake just enough to resume breathing, sometimes hundreds of times a night without the person ever remembering it. Over time, this constant cycle puts enormous strain on the heart, raises blood pressure, and significantly increases the risk of a fatal cardiac event during sleep. Millions of people live with it for years without ever being diagnosed. Sudden cardiac arrest. The heart is an electrical organ, and sometimes that electrical system simply fails without warning. Unlike a heart attack, which is caused by a blocked artery, sudden cardiac arrest is when the heart abruptly stops beating due to a malfunction in its rhythm. It can happen to people with no known heart condition, no prior symptoms, and no warning signs. During sleep, the body is in a vulnerable state, and certain rhythm disturbances are more likely to occur in the early morning hours. Without immediate intervention, the brain begins to suffer damage within 4 minutes, and death follows shortly after. Carbon monoxide poisoning. This is perhaps the most terrifying entry on this list because the victim never feels anything at all. Carbon monoxide is a colorless, odorless gas produced by faulty heaters, generators, gas appliances, and blocked chimneys. When it fills a room while someone is sleeping, it binds to the blood and prevents oxygen from being carried to the brain and organs. The person simply drifts from sleep into unconsciousness and never wakes up. There is no smell, no sensation, and no alarm from the body. It kills entire families overnight and is responsible for hundreds of deaths every year in the U.S. alone. Sudden arrhythmic death syndrome. Most people have never heard of this condition, and that is part of what makes it so unsettling. It occurs when the heart suddenly develops a fatal irregular rhythm during sleep in a person who appeared completely healthy. There is no blockage, no disease, and often no family history that could have predicted it. It is particularly associated with young adults and is believed to be responsible for a significant number of unexplained deaths that occur overnight. In many cases, an autopsy reveals nothing wrong with the heart at all, leaving families with no explanation for why a healthy person simply did not wake up. Positional asphyxia. The position a person sleeps in can, under certain circumstances, cut off their ability to breathe effectively. This is most dangerous for infants, heavily intoxicated adults, and people who are extremely obese. When the body is positioned in a way that compresses the chest or folds the neck forward, the airway can become restricted to the point where breathing becomes insufficient to sustain life. Because the person is unconscious, they cannot feel the distress or reposition themselves. It is one of the leading causes of death in infants who are placed on soft surfaces or in unsafe sleeping positions, and it claims adult lives more often than most people realize. Night seizures. Epileptic seizures do not only happen while a person is awake. A significant number of people with epilepsy experience their most severe seizures during sleep, often completely unknown to anyone around them. During a nocturnal seizure, the body can undergo violent convulsions, the airway can become blocked, and in some cases, the person stops breathing altogether. There is also a documented condition called SUDEP, which stands for Sudden Unexpected Death in Epilepsy, where a person with epilepsy dies during or immediately after a seizure at night with no clear cause identified. Many SUDEP cases are only discovered when someone does not wake up in the morning. Pulmonary embolism. A blood clot that travels to the lungs can strike at any time, but the hours of sleep carry their own particular risk. During long periods of immobility, the blood flow in the legs slows down, creating conditions where clots can form in the deep veins. If one of those clots breaks free and travels to the lungs, it blocks blood from being oxygenated, causing rapid respiratory failure. Large clots can cause death within minutes. People who sleep for unusually long periods, recently had surgery, or have underlying clotting disorders are at heightened risk. What makes it especially dangerous at night is that by the time symptoms would normally alert someone, they are already unconscious. Sleepwalking. Most people think of sleepwalking as a harmless quirk, someone wandering the hallway with their eyes half open. The reality is significantly more dangerous. Sleepwalkers have walked out of windows, fallen down staircases, wandered into traffic, and drowned in swimming pools, all while in a state of deep unconsciousness with no memory of any of it. The brain is partially awake enough to move the body, but not awake enough to process danger or make safe decisions. In rare but documented cases, sleepwalkers have died from injuries sustained during episodes that took them outside the safety of their home, without them ever knowing they had left.